Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help. Dr. Mallon, Dr. Adkins, Dr. Stone, thanks for joining our Zoom webinar. So we're going to be doing a quick podcast answering a question: should you wear a mask as general public? But we wanted to do it in this format to specifically show people what the webinar, the virtual summit that we're doing this weekend is. But we're going to have much smarter people on the panel. We're going to have Dr. David Sinclair, Scott Weingart, Ben Greenfield, Andrew Weil, Craig Conover, Darshan Shah, a long list of really incredible people answering questions about COVID-19 in their specific area of expertise. So if you want to not only watch that, but actually submit questions during the talk, go to wildhealthsummit.com, or you can just go to wildhealth.com and you can click on the link there at the top to join, but you have to register to participate. It's going to be a really incredible 3 days, this Saturday, Sunday, and Monday. It's going to start each day around 11 a.m. Eastern and go to 5 p.m. Eastern. That way, if you're on the West Coast, you're not going to be up super early either. But you're going to want to join. There's a lot of information out there floating around. There's so much conflicting information, and it's going to be that way. Just everything is changing so quickly. But we want to hear from people like David Sinclair, Scott Weingart, Andrew Weil, Ben Greenfield, and we know you probably do as well. So go register for that, and it's going to be this format. Today, I think we're going to kind of interview Mike, like he's the expert here because he's really been digging into this question. Should we wear masks? And we've got Dr. Atkins on as well because he did a great job summarizing how we're going to conserve our PPE, and that's a big part of this question, which we'll kind of get into. But Mike, I know that the World Health Organization and the CDC have both said that masks aren't necessary for the general public, but I heard from a very, very reputable source that we all should be wearing masks.
Yeah, who's that?
That'll be your wife. She told me that she's been trying to convince you, but you're not really convinced. But then you told me that just today that you actually did decide to dive into this literature, kind of because you wanted to figure it out, but mostly because you didn't want her telling you that she told you so later, which I think is a good decision on your part. Not really the safety part, but I know Brittany, and if you don't listen to her and you catch coronavirus, then there's going to be hell to pay, probably much worse than the infection itself. And just to be clear, just in case Brittany's listening, I'm not making light of her disagreeing with the World Health Organization or the CDC, but Brittany has a master's in public health. She's super smart. She's one of the only people in the world that I'm really scared of. She's been my boss for a while in the nonprofit that we have, and I've been scolded by her many times for not paying attention. So when Brittany says something, I want to listen as well. So when you've really dove into this literature, what have you found with regards to should the general public be wearing masks?
Yeah, so this is something that Brittany truly has been trying to convince me of for almost a week now, and I've been conveniently ignoring her, probably because of dogma and because the CDC told me to and the WHO told me to. And for whatever reason, yesterday I was like, I gotta look into this, after maybe like the 15 jillionth article that she sent me about it. And the thing that finally turned the tide for me when I was like, man, maybe there is something here was noticing that graph of all the different countries where, you've got all your Asian countries, which have basically flattened the curve. And then you've got all the countries in Europe and the United States that are still on the steep portion of the curve. And just sort of realizing that there's a large group of countries here that are currently wearing masks that have flattened the curve, and a large group who are not currently wearing masks in public who have not flattened the curve. So that was the first time, that was the big aha moment where I was like, man, I've really got to look a little bit closer at that. Now, granted, there are some confounders, like in most of these Asian countries, like, there's much stricter rules regarding social isolation, but still it does open the door that there is a possibility there.
Yeah, and in places like China where they're barricading people in their houses and making them prisoners in their own homes, that's a slight confounder to the mask question. But I think there is some data that you pointed out in some of the European countries
Yeah,
too,
so the
where
Czech Republic. Yeah, the Czech Republic actually released an order for everyone to go outside in public wearing a mask, and they made it mandatory. Not wearing surgical masks, not N95s. They actually are having their citizens make their own masks, and they've started to see some flattening as well. And they've got very similar social isolation rules to the rest of Europe. So that does speak to maybe there is something there.
well, but I think that what you just said, as far as them making their own mask, I think that's a really, really critical point that we'll want to dive into, because I think a lot of the underlying kind of the WHO and CDC not necessarily recommending, I think a lot of it comes back to the big shortages. So wearing homemade masks is probably going to be the solution if we do end up saying people need to wear these. So I think we should probably start off just by defining the different types of masks, which Brian did a great job in a prior podcast of that. But Mike, can you tell us the difference just a little bit in the different types of masks and what options there are?
Yeah, so briefly, there are homemade masks, which are anything that you put over your face and your mouth and nose. That can be anything from a t-shirt to, something fancy that you've made with cotton to tea bags. Some people have used lots of different things people are using for homemade masks right now. There's also surgical masks, which we sort of think of as the commonplace mask in healthcare. You'll see surgeons wearing this during operations. You'll see people in the emergency department or in clinics wearing this if they've got a cough. That's sort of the standard mask that we see in healthcare. And then there's N95s. And N95s are the one that we have the biggest shortage of right now. And those are...
So, Mike, I'm demonstrating a surgical mask. I'm not going to demonstrate an N95 since we can't get our hands on one, but I think everybody knows what they are.
So N95s are obviously the higher aerosolized blocking masks. When it comes to surgical masks or simple masks, the main purpose of those is really to block and protect you against large droplets. So now we're talking like 60 to 100 microns. So these are the droplets that you can kind of see when someone sneezes. I don't know if you've ever seen the slow-mo pictures of someone sneezing and there's all these water droplets coming out. Those are the larger droplet particles. So you can actually eject those particles anywhere from like 2 to 6, potentially even 9 meters when you sneeze and cough. So that's where the simple mask can be really beneficial in helping just sort of block your face, your mouth, and your nose from getting those particles injected into it.
Did you say 9 meters for a cough? Or I'm sure that's
sneeze.
A pretty powerful sneeze. Okay.
Yeah, that's like your grandpa's sneeze.
Grandpa sneeze. So that is the reason you would wear the surgical mask, is really to prevent that being expelled. And the N95 is
and to protect others too. So if you get sick and you're wearing a surgical mask, now you're blocking all that junk from coming out of your mouth when you sneeze or cough.
I think one of the other benefits just to keep in mind of like why something like homemade masks and cloth masks might make a difference is just the behavior modification from not touching your face. And, that there is potentially, we're seeing, the WHO and CDC don't feel like you're getting enough protection out of a cloth mask for droplets, but I'm not sure that there isn't a benefit there just in terms of keeping yourself from unconsciously touching your face as much as we typically do without paying attention to it.
Well, but is that true, Mike? And I'm not disagreeing with you, but one of the arguments I heard against the general public wearing masks is that some people said it would actually encourage you touching your face more because you're kind of pushing it up and adjusting it. So I don't really know.
I think I think if you're mixing it with education around not touching your face and around good hand hygiene, I think it's an excellent reminder. And the reality is, like, the really high risk areas on your face that you're touching are going to be covered by that mask. You're not going to be touching around your mouth, around your nose, and mucous membranes where you can transmit the disease more easily. So, again, like much of what we talk about with COVID-19, nobody really knows the answer to that. But I do think that if you're educating the public on excellent hand hygiene, not touching your face, having a mask on, I've definitely heard lots of people report that improves their just general awareness about keeping their hands away from their face.
And that makes sense. If you have a mask on and glasses on, you're probably not going to be able to touch your nose, your mouth, your eyes. And it's kind of a reminder, you feeling it on there. Mike, when you dug into this, what kind of literature were you finding about the usefulness of these masks?
So beyond just, we talked about the large particles, which can be very protective against these surgical masks, or even homemade masks can be very protective against large particles. There's actually some decent literature to suggest that they can protect you against aerosolized particles as well. So part of the concern about COVID-19 is we don't really know exactly how it's being transmitted. Is it just through droplet? More like influenza, or is there also a significant aerosolized component as well? And that's why so many people are wearing N95s and why most hospitals are wearing N95s. But it turns out that a regular mask, a surgical mask or homemade mask, can actually reduce aerosolized particle transmission as well. So a homemade mask around 3 times reduction in aerosolized particles, and a surgical mask anywhere from 4 to 6 times reduction in aerosolized particles. So that means that only like 15 to 30% of the aerosolized particles that come from somebody sneezing are actually going to penetrate the mask, even if they're sneezing directly in your face. And if you're sneezing or coughing, only 50% of the particles that you sneeze or cough, the aerosolized ones, not the large ones, are going to get past that mask as well. So while these masks may not be perfect for aerosolization of the virus, it still helps, and something is better than nothing. I think we've seen that through any social distancing.
One of my first thoughts when you say that, though, is if 15 to 30%, we don't need that many viruses to infect us. So on the one hand, I think, well, that's kind of useless if it's not getting pretty much all or over 95% like an N95. At the same time, I think there's some theories right now going on around why healthcare workers are tending to get a little more sick, and it may be because of the load of virus. So I don't know this for sure, but there is some thought that if you get a little bit of virus and you catch this, then you may not do as bad. And again, that's not been proven, but that's a theory going around right now.
You're certainly more likely to get sick the higher the viral load you get exposed to. And this virus is likely more contagious than influenza. But there was a pretty interesting study where they took influenza positive patients. They basically had them cough into a petri dish, right? And they did this with no mask, with a surgical mask, and then with an N95. And they found with the N95 or the surgical mask, if they hold a petri dish up to their face and cough and sneeze into it, I don't think they actually sneezed, but I think they mostly coughed, 0 of those petri dishes were positive for influenza. But if they weren't wearing a mask, then almost all of them were positive for influenza. So while COVID-19 is probably a little bit more contagious, you've got to think that a little bit is better than nothing. And what's the harm in wearing the mask?
So was that 0? Was that only with the N95 or with the surgical mask? They did both. The same. So with both.
Yep. And you think about it, you're mostly blocking those large particles that get excreted when you cough. One 100,000th of the volume of liquid that comes out when you cough is in these larger particles. So it's a very small amount of aerosolized particle, which is what we're blocking from the N95. So what you're doing by wearing a surgical mask should be enough, unless there's a really significant aerosolizing procedure going on, which is really only going to happen in the medical realm.
Probably 3 weeks ago in the ER that I was working in, I asked them to not let anybody come back into the ER that didn't have at least a surgical mask on for this specific reason. I think that's one of the things that we can do that's going to be most protective, at least in the ER, is every patient, every visitor, everyone that comes on, put on at least a surgical mask, not an N95. I didn't know that data and literature that you bring up, but I think if you're working in an ER or just any clinical setting, I think that's one of the first things that we really should do to protect our frontline providers is every person coming in, whether they have symptoms or not, at least put a surgical mask on.
And I think that makes a lot of sense. And to speak a little bit more about N95s, so the reason they're called 95s is because they block 95% of those aerosolized particles. And the difference between a large droplet and an aerosolized particle is really only size. So if it's less than about 0.3 microns, or really 10 microns, if it's less than 10 microns, then it's an aerosolized particle. The ones that we're really concerned about are the really small ones, like smaller than 0.3 microns, because they can easily get down into the alveoli of the lungs. Now, we know that that this virus likely infects us not just down in our lungs, in the alveoli, where you've got the ACE2 receptors, but it turns out that there's ACE2 receptors in your nasal mucosa as well as in your gut. And we know that because people have been testing positive with just nasal swabs for COVID. They've been testing positive with stool samples. And we've basically shown that there's ACE2 receptors all throughout your respiratory tract. So likely this virus can infect you in your nose, in your lungs, anywhere. But the whole concept of the N95 is that we're basically blocking aerosolized particles from getting in. This is important because there was recently a paper that was published out of Nebraska where they took samples of the air in patient care areas, and they found really moderate levels of viral particles just falling out of the air, so being aerosolized into the air. And they think that that was probably increased based on the amount of coughing that patients were doing and the amount of aerosolized procedures that were occurring. They actually found that some of the highest levels of the particles were in bathrooms. I don't know if you remember that study that showed that E. coli actually aerosolized when you flush a toilet. Probably the same thing is happening with COVID. I mean, granted, we don't have any data on it right now, but it makes total sense.
Well, it's funny. I don't remember that many studies very often, but I actually do remember that study because since I saw that study, every time I go into a public restroom and I hear a toilet flushing, I think about that study and the E. coli being aerosolized into the bathroom, which is, I guess I've kind of probably unwittingly, irretrievably placed that into the heads of all of our listeners as well now. So every time you hear a toilet flush, just imagine all the aerosolized fecal particles kind of spewing around, and that aerosolized. I mean, if you want a kind of a picture of that, you can think of sunlight streaming in through a window, and you see all the little particles in the air. Even though we don't necessarily see it in a darker environment like I'm in right now, it's always there, and that's why I think really the N95s are so important for the healthcare workers, because we're constantly being exposed to those places.
I think that comment needs a little bit of context, though, just before we panic people entirely. So, when all of us have been to public restrooms many times in our lives and have not contracted E. coli from going to a public restroom, the Nebraska study is really interesting because while there's COVID particles in the air, it's not entirely clear how sort of virulent those particles are. So, likewise, some of these studies about COVID, SARS-CoV-2 surviving on steel and plastic and cardboard and other surfaces, just because you can culture something, and in this case culture a virus from a surface or from the air and find that it's there, doesn't mean that it's retained the same sort of infective properties that it has when someone's sneezing or coughing on you. So I think it is worth taking a little bit of a step back and a chill and saying, you're going and using a public restroom. There's really no reason to suggest that that's going to put you at high risk for contracting COVID-19.
I kind of agree with you, Mike, but I kind of disagree with you too. I mean, I feel like in the sense that
no public restrooms where public restrooms are. I was going
to say, in the sense of that there's very little risk from wearing a mask. So why not? I mean, I just feel like
I don't disagree. I actually think that it's reasonable. It's super low risk to be wearing a mask. And I just want to keep those two things separate. I think that, yes, outside of the mask discussion, I think that going and using a public restroom without a mask is still extraordinarily low risk. Is it even lower risk if you are wearing a mask? Probably.
I think you need to take a big deep breath in before you go in. Don't breathe while you're in the restroom. Take a shower when you come out and burn your clothes, and that's the only way you're not going to have feces all over you and inside of you. That's been my experience with using public restrooms.
I think sort of some of what we're talking about is the same reason that that we're not all wearing masks right now, because it's just not commonplace in our society. It's not considered normal. But we also, as a society, have not been exposed to SARS or MERS. And you look at the Asian culture where it is totally acceptable, even without COVID-19 running around, to wear a mask all the time. And I think that what we're dealing with is fighting some social norms against something that makes absolute and total sense. And now that I've done all this research, it blows my mind that we're not seeing more recommendations from governmental agencies to be wearing homemade masks, to be honest.
Well, I've got to jump in for a second, guys. And first of all, this toilet flushing conversation, I had to share this story. My last ER shift, I saw a patient who was sent by their employer to be ruled out for COVID. And when I interviewed the patient, he had no symptoms. And when we called the employer said that he was coughing everywhere. And when I went back and asked the patient about that, he said that he'd gone into the bathroom and someone hadn't flushed the toilet. And the smell was so overwhelming that when he walked out into the hall, he was coughing. And his coworkers got so concerned. And so basically I got a COVID rule out because of the stinky bathroom recently in my hospital. But what I would go ahead and say with regards to what you're saying, I agree with Mike about this need to wear masks, but I do want to address a couple of things that people are going to bring up and that I've had people bring up to me, which is the issue of homemade masks. And there is some academic concern that they do retain moisture and that if they're worn for long periods of time, that they may actually increase the wearer's risk of having an infection. And I don't necessarily agree with that for a couple of reasons, but it's all that 2015 study that basically took 1,600 patients and they put them in three different categories. Randomized controlled trial of three different groups. One was people who wore cloth masks that were supposed to be washed with soap and water, but they don't mention hot water after each shift. And one was with traditional surgical masks, and then the third group was standard practice, but they could not ask the standard practice group not to wear masks because that may go against their standard practice and it wouldn't fit into the study approval by IRB. So what they found was the mask wearers, the homemade cloth mask wearers had higher rates of infections than the group that did standard practice. And in their conclusions and summary, they suggested that the cloth mask may itself carry a slight risk of infection because of the moisture trapping. Now, I think that when we talk about what Mike's talking about, I totally agree actually with Mike Mellon on his feelings that the cultures and the countries that are wearing masks and where it's more commonplace and culturally acceptable are flattening the curve better. And I do think there's something to that. What I would say to the study where the cloth mask had a higher rate of infection, first of all, it's still a reasonably not that large of a study of people. The other thing is, were these people actually compliant with washing their masks? And were they hot water washing their masks? How often were they changing their masks? So I think that it goes without saying that if a person wore an unwashed mask over and over and over in the healthcare setting where there's high viral loads, as you're speaking of, walking through an area with high viral load, it makes sense that these aerosolized particles and droplets could get absorbed into the tissue and over a period of time be present on a person who's breathing on the mask repetitively and put them at some risk. But I would say that just like with Mike Stone said, it comes with education, just like not sticking your hand in your nose and your eyes and your mouth. That it comes with education, that you don't just wear the same cloth mask into high risk areas over and over and never watch this mask. I think it comes with that education piece. And I also think that there must be something, as you spoke earlier, about it's not just like Matt Dawson was saying here that he had people in his ER all coming back with their masks on. I think that there's something to do with the protection to the rest of us from the mask wearer. So I believe that something is better than nothing for the wearer, especially if it's kept clean and probably hot water, warm water washed. But I think that also there's a lot of protection for the rest of us.
It's going to have to require some education, just like the CDC is spending a ton of money on teaching people how to wash their hands. You're going to have to teach people that, look, you don't grab the front of your mask. You got to treat it like it's got virus on it. So your hand should not touch that. It should, you should grasp the loops around your ears and pull off the mask that way. You got to teach people to wash the mask. You got to teach people to wear glasses too, because the lacrimal duct connects your eyes to your nose. So if somebody spits a droplet into your eye, then it's going to basically travel straight down to your nose and get into your nasal epithelium and get you infected. So a mask isn't enough. It's got to be glasses too. So there's definitely, I think you're right, Brian, there's definitely education that's going to have to happen along with this change in dogma.
I think we're talking though, and we're assuming a couple things. I want to make sure everybody listening is working with those same assumptions. We're talking about homemade masks right now, not because they're better, but we're talking about that because of the shortages. That's a major issue we can't really just gloss over. If it is better to wear masks, we're in a situation right now where I was listening to a podcast that Michael Osterholm was on, and he was talking about 3M, the major manufacturer of N95s, can only produce 35 million a month, and we may need well over 100 million a month going forward in the near future. So the reason we're talking about homemade masks is not because they're great, but I think we're all working under the assumption that right now, the general public, everyone wearing masks would potentially be a negative thing. Because if you think about everyone taking a surgical mask and walking around with it, we probably will slow the spread in the community some, but the shortage that creates within the healthcare environment may be a bigger negative than that positive. So
in
I think
Italy,
we've made the
we've
jump.
seen the hospital systems of Italy have been the epicenter for the transmission of the disease, partially because they didn't have enough PPE. So yeah, I mean, absolutely, Matt, you're totally correct. This assumption is based on the fact that the consumers in the public are not competing with healthcare workers for masks. Absolutely.
So that's why we're talking about homemade masks. So just to clarify, we don't think that's the best option. That's just the best option in these horrific circumstances that we're in. And we do need to address, if we're going to be talking about things and disagree with the World Health Organization and CDC, we need to give them a little bit of credit and talk about why they recommend what they do. Because if you look around the country, there are other people who are kind of agreeing with what we're saying now about masks. The UCSF, they started recently having all staff, faculty, trainees, and visitors in the hospital wear masks. Mass General are now giving all their employees masks to wear. I mentioned in my ER, everyone here, when I got in for my most recent shift, all of the employees are wearing masks. So as a group, we're starting to realize that these asymptomatic spreaders, whether it's in the hospital, there could be nurses and techs here that are spreading right now and asymptomatic. We need to protect the vulnerable in our hospitals. At the same time, a survey that came out last week from the Conference of Mayors said 92% of them said that they don't have enough supplies for the frontline workers. So that's why we've made this leap rather quickly to homemade masks and talking about that. And I think that's a big part of the issue with the World Health Organization and the CDC. If you look at their current recommendations, and it's important to timestamp this because it seems like it's changing so quickly. As of 2 days ago, the WHO, they had a press conference and they addressed this specifically. And 2 days ago, so we're talking on the 1st of April, so on March 30th, they actually said, no, the general public does not need to wear masks. And if you read through that, one of their arguments was there's no definitive evidence that wearing masks decreases spread. They didn't say that it doesn't work. They made this no definitive evidence. And if you ask them the question of if you're going to cough, should you cough into your shirt or the crease of your elbow? They could answer it one of two ways. Yes, do that because it makes sense. Or they could say, well, there's no definitive evidence that it helps. They're going to say to do that because we don't have a shortage of elbows and shirts to cough into. So I think they're in a tough spot here. And then just today, we were planning on talking about this, and just a few hours ago, the Surgeon General gave an interview where he said that he asked the CDC to relook at this issue and to give new guidance. So when we publish this tomorrow, there could be new guidance. So it's important to timestamp and to kind of give the CDC and WHO some credit and understand the position they're in if we're going to slightly disagree.
I think most people are concerned that the CDC and WHO have made these recommendations based on mass shortages. And while there might not be any clear evidence that COVID itself is not blocked by a mask, there is pretty strong evidence that masks and barriers are the most consistent means to block the transmission of respiratory viruses. There was a Cochrane review in 2011 that basically found that very thing. Cochrane Review is a large medical research center that basically reviews medical literature and then makes recommendations. And they found that masks and barriers are the best way to reduce the transmission of respiratory viruses. And COVID-19 or SARS-CoV-2 is clearly a respiratory virus. So I think there is literature. It's just not specific for SARS-CoV-2.
Yeah, and it's important how you read the literature too. I saw one of the articles cited by, I think it was the WHO, saying there's no real evidence for this, was a big meta-analysis looking at the question. And in the big meta-analysis, 6 out of the 8 randomized controlled trials for influenza, they were comparing wearing masks or not, and did it decrease the spread. 6 out of the 8 didn't show a difference. So they kind of concluded, okay, for influenza, this doesn't work. And so they they based some of the recommendations on that. However, I would say two things about that. In that same meta-analysis, they looked at SARS, and it did make a difference. And so when we're comparing this COVID, yes, there's no definitive evidence because it's not been around long enough to study it. But if we're trying to figure out which one is more similar to influenza has an R naught of around 1 to 1.3, whereas the R naught of SARS-CoV-2 is double that. So, I mean, if I had to guess personally, I would say if we did do a randomized control trial, I bet that wearing masks in the general public would slow this down. We did see that with SARS, at least in the limited studies they had on that.
All right, so let me summarize. There's 4 reasons that I think wearing a mask is probably going to be beneficial for the public transmission of this virus. The first one is that asymptomatic carriers wearing a mask are less likely to infect other people. The second one is that healthy people wearing a mask, pretty much any mask, are going to have some reduction, at least around 3 to 4 times, in possible infection from aerosolized and large particle droplet when they're exposed to infected people. Now, granted, that's not going to be as good as an N95 mask, but something is better than nothing. Third, we've seen in Asia and then now in the Czech Republic that on a broad scale, it appears that masks may potentially reduce the transmission and flatten the curve to some degree. And then 4 is actually Stone's point earlier. Wearing a mask prevents you from doing things like picking your nose. It prevents you from touching your mouth and getting your hands in your face and potentially infecting yourself after you touch an infected surface. Now, with that comes some needed education, because if you touch the mask and then pick your nose, then you've got a problem. But I do think there's something there. I think just wearing that mask and blocking that hand-to-face contact has got to be beneficial. So I don't see the downside at this point, and it feels weird to go against the WHO and the CDC on this one, guys. I got to be honest, but I can't not say it. I feel like everyone should be wearing masks when they go outside now.
Well, you did say the downside. The downsides are 1, the supplies. We've already addressed that. We're talking about homemade, and 2, taking it off and doing it inappropriately. So those are the downsides, but you've addressed both of those. What were you going to say, Brian?
Oh, I think exactly what you're going to say, which is the downside actually is the supply. And in fact, I got pulled in with a very intelligent layperson in the community, socially active, who's had me help her with a superhero mask project, which is where we're making cloth masks from homemakers all over Kentucky and shipping them out throughout the United States. And in doing so, I spent a lot of time talking to these folks about it. And what we found is not only is there a shortage of surgical masks, but there's a shortage of the general elastic that is used for making the homemade masks that most homemakers make. And then beyond that, the secondary replacement for the elastic is a bias tape, something called bias tape. And now there's a rush toward bias tape because elastic is out, and now bias tape is in short supply. So if that tells you from just a layperson's perspective, if you knew nothing, if you weren't medical, and I just called my friend who's an intelligent layperson and said, the CDC is getting ready to perhaps suggest that all laypersons wear masks, she would say, oh my gosh, now there's definitely going to be no elastic and no bias tape for us to sew masks for other people. So I think that you addressed exactly my thought, is that Mike is correct in his convictions. And my assumption is the CDC and WHO behind closed quarters are discussing mask shortages and supply with regards to the recommendations.
Dr. Stone, I know you have to go. Any final thoughts from you before we wrap this up?
Yeah, I mean, I think the biggest take home is what we can, in a time of very limited randomized controlled prospective trials, or even prospective trials that are uncontrolled. I think Mike Mallon's thought of looking to places that have had success with flattening the curve, there's nothing better than looking at places that are modeling the behavior that we want to see. And yes, social distancing practices in Korea and in China have been a lot more extreme than what we're seeing, and it's hard to know how much of it's mask related and how much of it is more general social distancing related. But I don't see a downside, and I certainly wouldn't go against Brittany really on any level. And I think that following Brittany's advice probably is a safety measure in more ways than one.
Well, we're all at more risk from going against Brittany than the CDC and the WHO. So I think that's a good conclusion. I hope she doesn't listen to this. So if you found this helpful at all, what I would say is register for the Wild Health Summit. There are going to be people much smarter than us talking about these issues. We personally have spent a lot of resources, both money and time, to put this together because we really believe that getting good information out there that is timely and accurate from scientists, the people who we've invited, is important. It's completely free for you. So go to wildhealth.com and register for the summit. And that actually starts in 2 days from now. We're releasing this on April 2nd. It's April 4th through the 6th. You can join for as much or as little of it as you'd like. And if you didn't enjoy this while you're still listening.
Thanks, guys.
Thanks, everyone.
Thanks so much for listening to this COVID-19 update. Please send us your questions or follow along on Instagram and Facebook at WildHealthMD. And just to be clear, this is not medical advice. No patient-physician relationship has been established, and this resource is really for general informational purposes only. And finally, if you want to spread the word, please send this podcast to friends and family and give us a review on iTunes. Thanks again, and stay safe.